Imagine being able to screen your baby for common chromosomal abnormalities with just a simple blood test from the mother without any risk to the pregnancy or the fetus. Sounds remarkable, doesn't it? Today we will discuss the non-invasive prenatal testing, also known as the NIPT. We will cover what is NIPT, how it works, and when it should be offered, what are the advantages, what conditions can it detect, and its limitations, and how to interpret the results in the clinical practice. So NIPT, also known as non-invasive prenatal testing, is a screening method, and what happens that we take around 10 ml of maternal blood. This maternal blood contains the maternal cellular DNA, maternal cell-free DNA, which is coming from the adipocytes, that is the fat cells and the white blood cells, and the fetal cell-free DNA. This fetal cell-free DNA comes from the trophoblast or the placental sites into the maternal circulation. So can you see this maternal blood stream? And in this maternal blood stream, we have the maternal DNA as well as the fetal DNA along with RBCs. And the laboratory extracts these maternal cell-free and fetal cell-free DNA. Non-invasive prenatal testing does not separate the maternal and cell-free fetal DNA, so we have to calculate a fraction which is known as the fetal fraction. So fetal fraction, yes, so we have to calculate the FF. FF is the fetal fraction. Fetal fraction constitutes a fraction of fetal cell-free DNA, of the fetus upon the total cell-free DNA. Okay, and this is multiplied by 100. So here we can calculate the fetal fraction percentage, and this fetal fraction percentage should be more than 8% to achieve the best performance results. Hence, adequacy of around more than 8% is required for the proper testing. If the fetal fraction is 0 to 4%, then the fetal fraction is too low to report. If the value is 4 to 8%, then intermediate fetal fraction, and it has decreased sensitivity also. So now look at this image. So non-invasive prenatal testing is a safe screening method which is used to detect the pregnancy having genetic conditions in the fetus, and it analyzes small fragments of cell-free fetal DNA found in the mother's blood, providing insights into the baby's genetics. The timing is it can be performed after 10 weeks of pregnancy, and the safest time at which we can do this test is 13 weeks till, anybody can tell, 13 weeks till 22 weeks, but it can be done till delivery also. Hence the diagnosis window or the gestational age window is very wider. Hence it is an ideal screening test, and there is significant reduction in the invasive testing if we do this, because the diagnostic rate is more than 90%. The false positive rate is just less than 1%. The positive predictive value is 63%. Now there are certain conditions which this test can detect, and the chromosomal conditions such as the Down syndrome, Adverse syndrome, and the Patau syndrome is there. Now there was one study which tells that for trisomy 21, trisomy 18, and trisomy 13, for NIPT, the detection rate for trisomy 21, that is Down syndrome, is 99.7%. For trisomy 18, it is 98.2%. And for trisomy 13, it is 99%. So it is the best test. Also, there are hidden benefits of this test also, that we can do the Down syndrome profile, Edward syndrome profile through this test. And now coming to the patients who are the candidates for this test. So NIPT in India. So NIPT in India is offered in these indications. So NIPT in India, when we are going to offer, it is offered to a very few women when the maternal age is, because it is very costly also, maternal age is more than 40 years, then you have to offer this to the patient. Then if the prior screening result shows intermediate risk in prior screening test, the soft markers of aneuploidy are positive. What are the soft markers of aneuploidy? That you do on the first level 1 scan, that is NTNB scan, or the level 2 scan, that is TIFA. Soft markers are positive, and if there is prior history of trisomy. So you have to cram these 4 indications: maternal age more than 40 years, intermediate risk in prior screening test, soft markers are positive, and if there is history of trisomy in the previous child. Ideal time, we have already seen that the ideal time for offering this NIPT is 13 to 22 weeks, and so that there is this is the time when the fetal fraction is maximum and the termination is possible, hence this is the ideal time. NIPT in twin can also be done, which is very reliable, and in the current Indian text, the NIPT is most sensitive screening test, and as per 1100 rule appears to be pragmatic. NIPT does not replace the diagnostic accuracy and precision of invasive testing, and there are chances of future screening also.